I'm Jessica Frasco from the American Society of Plastic Surgeons, and today we're here with Dr. Weinstein and Dr. Rohrich to talk about breast augmentation. So the first question today is, who is a good candidate for breast augmentation?
That's a great question. You know, not everybody's a candidate for breast augmentation, but certainly someone who has congenital absence of the breast, or very small breasts, and it's proportionally small for their body. Providing that they're healthy patients and not overly thin, you know, they could be a good candidate for breast augmentation. What do you think, Rod?
Yeah, no, I think breast augmentation is an elective procedure in most cases, except if, and sometimes in a teenager, if they have significant asymmetry or absence of the breast, then obviously it's something that has a lot of psychological advantages of doing augmentation at an early age. But I think the best candidate is someone who's young, who's healthy, has got a good mindset psychologically of what they want to do. The goal in a plastic surgery procedure is to make the patient proportionate to the rest of their body, and I think that that's the beauty of seeking out a board-certified plastic surgeon, is that you will get someone who applies the art with the science of a breast augmentation, putting in the right implant in the right patient, not oversizing them, not making them look out of proportion.
Natural proportional breast augmentation, and also having them have cleavage and not armpit breast. And it's critical that a plastic surgeon who's board certified and understands the nuances of this should do the procedure.
Right, and I think the other thing is, you know, implants are man-made, not God-made. They don't last forever. They last 10, 15 years, and people need to know that. In fact, that's like all medical prostheses. They last about 10, 15 years, and implants are no different.
Well, I disagree with you, because I have patients that last 28 years without a problem, but certainly if we say 5 to 10 years, we're better off. The other critical question I wanted to talk about was, what type of anesthesia should we use for breast augmentation? And I think that most of us use general anesthesia because the patient's more comfortable, but there are select patients who can be done on the local standby. Is there ever a time when you use local standby, Dr. Rohrich?
You know, I used to early in my practice, but I actually like to have the patient asleep. At least in where I live in Dallas, Texas, people like to have general anesthesia. I like to talk to my patients before and after surgery, not during surgery. So I like to have them asleep. I think I can do a better job with my patients being asleep, but it's very specific. In some places in the Midwest and maybe the Northeast, they actually can be done with sedation. I think the most important thing is that they're done safely, either with a board-certified anesthesiologist or a board-certified CRNA, nurse anesthetist. I think those are all very important things. And of course, done in an accredited facility. So I think those are the most important things. But these are usually done in healthy young patients. Takes an hour, hour and a half to do it. They come in, go home same day, minimal time off from work. You know, return to work in a few days, back exercising in a few weeks.
And the other critical question was, what's the recovery like? You're saying back exercising in a few weeks. My patients, they want to go back to exercising right away. But I think most of us recommend a minimum of 3 weeks of non-exercise and getting back to the usual routines. How do you feel about that?
I totally agree, because you know, we cannot change God in wound healing, and wounds take 42 to 60 days, so that's how long the patient has to not exercise aggressively, otherwise they have problems. But they can be back, you know, they can shower the next day, they can be out to dinner, they can do all the things, they can go back to work if they're not lifting anything more than 10 pounds. You know, that's really been transformational to most patients, but you know, we've all had the patients that, you know, have tried to go exercise in 3 to 5 days, and sometimes that's not a good thing.
Not a good thing. Or they go out dancing the night of surgery, which is not a good thing. One of the things that we've done is
the kind of dancing they're doing.
Well, look, not that kind of dancing. But the other thing is we use Marcaine anesthetic, which lasts 4 to 6 hours, and we're also using anti-nausea medications so that the incidence of sickness after the surgery is very small today. I want to thank you all for listening to those 3 critical questions about breast augmentation. Here we are at the Plastic Surgery Meeting 2016.